Nature's wealth, good for your health. This is the Raw Life Health Show.
Hello, everybody. Welcome to the Raw Life Health Show. I'm so excited to have back our guest, Dr. Spindelilus, known as Doc. The interview I did with him was amazing. Welcome back, Doc. How are you?
I appreciate it. I'm doing great. Wanted to say thanks again for bringing me on your show. I love your show, but I have to admit I was absolutely surprised about the response from the last one. And we're here to serve, so I appreciate all the patients that came to us from your last show and the wonderful response and well wishes and compliments. So again, thank you very much.
Well, it's really important, the information you're getting out there, and I want as many people to know about you as possible. I got a lot of questions. So I want to start off by saying that I'm going to ask some of those questions now. But
Right.
for those of you that have a question or something, you could post them below the video. But coming up on Tuesday at 8 p.m. Eastern Time, depending when you're watching this, that's Tuesday, July 18th at 8 p.m. Eastern Time. Myself and the doc here will be doing a live Q&A, so you'll get to speak to him directly. So I'm really excited about that. So mark your calendars, everybody. And I know there's not big notice, but hopefully a lot of people will tune in to that. But as for today, you mentioned about the conditions you work with. And some of these conditions are conditions that a lot of medical doctors do not have an answer for. So when I say that like something like cancer, they have an answer for. You and I agree that's not the best answer, but they have an answer. But
Yeah.
things that you take on are things like you know, when you get stuck by a bee or
Okay.
a tick, yeah. And I saw a great movie called Under Your Skin that talked
Right.
about this. It's a very misdiagnosed thing. It's called Lyme disease, and doctors do not have an answer for this. And the reason why it piques my interest is because often people come to me with symptoms, and the doctors will diagnose them with whatever they diagnose them with, and I'll say, to me, it sounds like Lyme disease. Now, I don't know how to do what you do and help people with Lyme disease, but I pretty much know the symptoms.
Right. Right.
So let's say there's two type of people with Lyme disease: one that just got stung by a tick and they know it, and one that doesn't know it. So can you explain in both scenarios how you treat people or what you recommend for people?
Absolutely. What you described was the difference between acute and chronic. Unfortunately, I have to say, I've been in medical practice now for about 24 years and 24, 25 years. And in all those years of and again, our practice, we treat everything from boo-boo toes all the way to working with cancer and such. Lyme is one of my specialties that I work with. Um, in all those years I've been working with Lyme disease, I can count on one hand the number of acute cases I've received, because unfortunately, you mentioned the video, absolutely excellent documentary. You can watch it for free, I think, on YouTube and Netflix and Amazon. Under Your Skin, amazing documentary, and really what it is an expose of the CDC and how they covered up the reality of Lyme disease and how they were working with another pharmacy. I won't get into that, but it is because of what the CDC did, covering up Lyme disease and such, that most doctors today are not what we call Lyme literate, meaning they have not been trained in Lyme disease. And 9 times out of 10 that you go to a standard doctor, they will refuse to even test for Lyme disease because they still remember the CDC poo-pooing Lyme, and they don't realize how the CDC has had to go 180 and admit that it does exist. So unfortunately, the vast number of what could have been acute cases treated are not being treated because they're being misdiagnosed. Oh, you had a fever, you had a flu, and that's what they say during the early
Now,
symptoms of.
not to interrupt you, just
No,
for the viewer's response or the viewer's education, briefly explain the difference between acute and chronic. So,
sure. Okay, acute pretty much is when you have been bitten by the tick, and it's usually within the first 3 months. The first 3 months, it's acute. You'll get this fever, and then it'll go away. and then that's pretty much, and it can be a really bad fever, and then it goes away, and then the bacteria begins to do its job. So it comes and goes, and people don't realize that there was nothing really big about it. Uh, One of the things they say is, oh, look for the rash. But unfortunately, the rash really only, the bullseye rash that a lot of people are told about, it really only shows up in about 20% of the cases. So 80% of the cases, you won't get that bullseye rash. Now, it's wonderful when you get it, because even a doctor who's not literate in Lyme may at least err on the side of caution. Then you have chronic. All right, so you got bit and nothing was done about it, and now it begins to do its work. And what it does is it begins to destroy the joints, destroy the nerves, eventually starts damaging the heart, and then it eventually gets to the brain. And that takes years and years. So the average patient that comes to me, because they were never diagnosed correctly in the very early stages, they're usually 10, 15, 20 years into the damage of Lyme. So you missed it during the first 3 months, and then it begins to silently do its job. And then
When you say
unfortunately,
10 to 20 years, what do you mean? That it's 20 years after, or for 10 to 20 years they'll experience symptoms? What do you mean?
no, great question. Great question. About 10, 20 years after the bite, after the initial fever that they get. And what they've done by that point is there's so much collateral damage that they're going to doctors going, why do I have what appears to be arthritis? What is this massive joint pain? Why is my heart starting to show pathology? And so the doctors will, and even then, most of the time they will misdiagnose it. They will call it, two of the most common misdiagnoses are lupus and MS. It is extremely rare. I'm trying to think of one MS case, and I'm not saying it doesn't exist, but I'm trying to think of one MS case I ever had that actually wasn't Lyme, and it was misdiagnosed. And I've got case histories I can share with you. But it's usually they're going to the doctor because of the symptoms that occurs after about 10, 15, 20 years.
Okay, so if somebody gets bit, let's say 10 years old, you're saying when they're like 20 or 30, they'll start experiencing this major symptoms.
Yeah, they're starting to go, what is wrong with me? Why am I under such extreme fatigue? And the doctors will run test after test after test, but they won't run Lyme, or they won't run the right Lyme test.
Now that's what I was going to ask you next. So the Lyme test, or the right Lyme test, because we're going to hear about how you would treat these people, but let's hear about the test to confirm, like you and I know the symptoms. Like just like you said, if somebody comes to me with chronic fatigue or lupus or MS, or they don't know, they haven't had a diagnosis, but they tell me that you and I pretty much know, well, this is what it possibly could be. What's your confirmation? What blood work or what test do you suggest to confirm, yes, it is Lyme?
Absolutely. Well, the most common mistake that a doctor will make when they're at least considering Lyme is they'll run what's called the Western Blot reflex, a worthless test, absolutely worthless test. Most insurances will pay for that because the physician's rates, for example, is only like $60. All right. So they'll run that almost 100% of the time. It'll come back negative, even if they have Lyme. But that's the only test that they'll run. The correct test, and this is according to Dr. Burrascano, who was also highlighted and featured in Under Your Skin. He's treated over 11,000 patients worldwide. He no longer treats because of the politics as such, from what I understand. But his recommendations, and it's what I've been doing for years and years. First one is the Western Blot Serum. The Western Blot Serum, not the Western Blot Reflex, but the Western Blot Serum. It actually breaks down the antigens that show up from the bacteria that can be in your blood. But I'm going to give a caveat in a second. And the second one, which is extremely important, but it has to be run correctly. And the only lab I agree with running this is LabCorp. Okay, and that is what's called the CD57. All right, your CD57 on average is supposed to be a 200 and above. When we run CD57s because we suspect Lyme and we see it starting to get down to 100, 120, we're looking at a good possibility of Lyme. And 60 or below, almost guaranteed it's Lyme. Now, there's a problem with the Western Blot Serum, and I want to make sure I make this very clear. Dr. Burrascano said that this could happen. I've actually seen it happen. The Western blot serum is supposed to show the antigens to the different proteins and such that's within the bacteria. It can come out completely negative, and you still have Lyme. All right, because one of the most important things for people to know about Lyme is it is an immunosuppressive disease. I basically call it the AIDS of bacteria. Whereas AIDS is a virus, Lyme does the very same thing, only as a bacteria. It suppresses your immune system. So what usually happens is people don't die from Lyme. They die from the co-infections, very similar to HIV. They die from the co-infections and the cancers, the unusual cancers and such that can come about from it. So when you get bit by the tick, and if you actually do get Lyme, because you don't always get Lyme just because you got bit by the tick, one of the most important things for people to know is the deer tick, which is the most common transference vector that they have with it. And by the way, even the CDC finally admits Lyme is the most common vector-borne disease in the US, meaning a disease that has been passed from some other like animal or some other source like that. But when you get bit, the Lyme tick has 4 phases of growth. It only transfers the bacteria in phase 1 or 4. 4 is the big growing up. But phase 1 is the nymph. It's like the size of a pin, the head of a pin, all right? It has to hold on to you for about 36 hours. The bacteria is in its gut and it comes out through its saliva. So that's why most people go, well, I don't remember being bit by a tick because it's so tiny and they miss it. And if it can hold on for 36 hours, there's a good chance it will release the bacteria. Now, if you have a good immune system, there's a good possibility you'll be fine. But unfortunately, in America, because of antibiotics and such, they have very poor immune systems, so they don't fight back. All right, so the tick bites you, you get infected. Because it's immunosuppressive, yes.
You said if you have a good immune system. So does this mean if somebody gets bit by a tick that's contagious in stage 1 or 4 and they have a good immune system, it'll reduce the chances of them actually getting infected?
Vastly.
Interesting.
Okay, I've lived in the eastern and northeastern United States where it's really the worst. It's throughout the United States, but it's worst up there. I can easily say I have been a blood donor for ticks. I have been bitten all my life, but I have a strong immune system, so it never got to me.
Okay. Continue what you was
I'm sorry.
continue what you were saying. I just had that.
Okay, so let's just say you get bit and then because even the CDC now admits there are 30,000 new cases a year. 30,000 new cases a year. Lyme is now on every continent of Earth except for Antarctica. So remember that. Because it's immunosuppressive, those antigens don't always show up. So we'll run the CD57, and even if it comes back negative, we're still going to run the CD57. We run the Western blot. We're still going to run the CD57. If the CD57 shows us a low, CD57 is the same as like the CD4, which we run for AIDS, for HIV. It shows your immune markers are dropping because you're losing the battle. The same with the CD57 for Lyme. If we see a very low CD57, even if we get a negative Western blot, and the clinical subjective objective shows us this is pretty much Lyme, we know it, we'll go ahead and treat for it. And what's interesting is we will rerun the Western blot serum about 60 days into treatment. And lo and behold, all the markers start showing up. And of course, understandably, one of the first things patients say is, oh, I'm getting worse. No, it means your immune system is fighting back now. It's beginning to produce, antibodies to fighting the bacteria.
Well, even though the blood test looks worse, it's actually working.
Yeah, it means you're actually fighting back. The total negative means if you do have Lyme, you're not winning the battle. You're not doing very well because your immune system's not fighting back.
That's interesting because with certain cases of blood work with cancer, it's the same situation. Your blood work might look worse, but it's actually improving.
In fact, I just got blood work back on a patient today, and her CA15-3 was up slightly, and is like, this is actually fine. Everything's going great. Absolutely. Because again, cancer is another kind of situation. It's systemic failure of the immune system. Almost everybody's exposed to cancer, throughout their lives. But do you have the immune system to knock out that little errant cell?
Okay, I want to talk about that, but let's continue on the Lyme.
Sure. Okay, so those are the 2 main tests. Now, the sad thing is that when most people have at least gotten those tests, they're easily being charged $1,000 to $2,000 for those tests. And I wrote a book, and in the book, it describes where you can go get those tests for about 1/10 the price, still from LabCorp. One of the sad things is a lot of people don't realize that we get what's called physicians' rates. We get discounts on everything, so we get to charge you whatever we want for labs, which is not appropriate. Um, the labs themselves don't cost as anywhere near as much as patients are being charged. And so I have a book out, and it's called The Holistic Approach to Healing Lyme Disease, and it tells you how to get these labs if you don't have a doctor who's cooperating, for about $200 something for both tests versus $2,000. So in answer to your questions, those are the two tests I highly recommend: the CD57 and the Western Blot Serum.
Okay, so I'm going to tell people here, let's see. So you're saying with LabCorp, right? Now, why don't you recommend the other laboratories?
Yeah, for a couple of reasons, and this is now through experience. Initially, Dr. Brascano recommended only LabCorp, and I thought, okay, I've done a lot of labs through LabCorp, that's fine. But I'm not going to name names. There are certain labs out there that way overcharge for these tests, and there's other labs that are incompetent. When you do a CD57, it has very special shipping instructions, very, very special shipping instructions, the way it gets sent to, because when you go to a lab, say it's LabCorp or Quest or somewhere else, that's really 99% of the time it's just a draw station, and it has to be overnighted to their actual laboratory itself. Most labs do not treat CD57 correct, so by the time it gets to the lab, it's already invalid, but they will still give you results, which are invalid results. LabCorp has a much better history of taking care of the sample correctly.
Okay, so one of my questions to you was going to be is, can you do the test non-remote? Like they don't have to be there, and you just answered the question. They can go to LabCorp is everywhere, and you can go everywhere to get tested from them. So I use a website that uses LabCorp, and I'm gonna go through this now before I recommend the website here. Is to find out, because I typed in Lyme, and it says Lyme disease antibodies, IgG, IgM, immunoblot blood test, and this one's from Quest, and it's called an I. So what about this test? I mean, is this
Okay, again, it has to say Western Blot Serum, and the other one has to say CD57.
Okay, so that's that one's out now. Have you heard of those before?
Yes, I have. Absolutely
Okay,
have.
so those aren't reliable confirmations, is what you're saying.
Again, I wouldn't go through Quest.
Okay, well, okay, so let's see now. They have this other one.
Because you should be able to go to LabCorp. Well, here, can I go ahead and share with them a website that they can get these through?
Yes, I'll put it below. I'll put the link below.
Okay.
Now, I'm curious for me and my people that when something goes
Okay,
on,
well, it's walk-in lab. It's walkinlabs.com. Okay, and you can literally type in CD57. It'll take you to it. You can literally type in Western Blot Serum. It'll take you to it. They always give you a choice between clicking LabCorp and Quest. Always click LabCorp for it.
Okay, so it's called Western Blot.
No, it's called walkinlabs.com.
No. Okay, walkinlabs.com. I'll put the link below. But what's the name of those two tests again?
Western Blot Serum.
Okay, hold on. Western Blot. Okay, and what's the other one?
And Western Blot Serum. You have to make sure you use Serum. Otherwise, it'll send you to the reflex. And the other one is CD57.
If
you have a hard time finding it, what I can do is I can send you the exact links for it.
Okay, well, for everybody that's watching, do the research, but you just type, go to the website that the doctor said to go to get those tests. I was looking on a website that I use for tests, but
Sure.
you know, but either way, get this test done. So it's such important information. So somebody gets a test done, they confirm that they have this. So let's say somebody with MS comes to you and or calls you, and you say, well, let's get tested for Lyme. So now they've been told by doctors for years they have MS. Correct. They get tested for Lyme, or even lupus, and then they get tested for Lyme, and then you confirm, okay, you have Lyme. Now, can somebody have? I know you say MS and Lyme are symptoms, or not even symptoms; they're mimicking the symptoms of the Lyme. But if somebody has MS or been diagnosed with MS or lupus, and then you find out through their blood work they actually have Lyme, does that mean they don't have MS or lupus, or does that mean they could have both, or what?
Okay, well, the nickname for Lyme is the Great Mimicker. It that's what it is. It mimics other diseases. MS is not okay. The diagnosis of MS is not a absolute hardcore definitive diagnosis. There is no blood test. There is no. You basically take in a lot of different information. You put it all together from the patient, from labs, from scans, and you rule everything else out and say MS. But one of the most crucial factors that are used are lesions in a particular region of the brain. They go, everything else matches MS. You seem to have an autoimmune, you have the symptoms, and you have these lesions. You have MS. But what they didn't do is they didn't do one other set of tests, and that's Lyme. Lyme produces the exact same lesions in the brain. I had a patient years ago that she came to me originally for MS. All right, so I said, all right, the diagnosis MS, I'll treat you for MS. And sure enough, she actually did start getting better because we were treating her immune system similar to what we did for Lyme, but not as aggressive. And within about 3 weeks, her vision and her swallowing were improving. When she came to us, she was on a cane. After a few weeks, she was no longer on the cane. We treated her for about a year, and she actually improved enough to where she could move out from her parents' home. She was in her 30s. She did something I highly did not approve of, but I was happy for her. She could wear high heels. She was doing great. So we said, okay, you're fine. Go away. And she did. About 2 years or so later, I was taking a break in the clinic between patients, and I walked up to the front of the clinic to see my staff. And there she was with her mom, but she was on a little walker. And I went, what happened? She said, no, it was just a coincidence. The walker is because she had just fallen and hurt herself. She said, but since you're here, my symptoms are returning. And I said, did you ever go back to your old lifestyle? She said, no, I did everything that you said, but they have been slowly returning over the past probably 6 months. And I went, do you mind? Can we run a Lyme test? She said, absolutely. Came back flaming Lyme. She definitely had Lyme disease. Now we started treating her for Lyme and started making progress.
Now, when she first came through with MS, when everyone comes to you for if they have MS or lupus, don't you run the Lyme test like then, or what?
This was quite a number of years ago. And
Okay.
I was not doing it as often as I do now. If somebody comes to me with MS, pretty much the first thing, MS, lupus, those types of autoimmunes, first thing out of my mouth is, have you been tested for Lyme?
So what else, other than MS or lupus, what else are often?
Pretty much just about any autoimmune condition it can mimic. I've even had patients, I had one with rheumatoid arthritis who ended up, because Lyme will actually damage the joints, it can be misdiagnosed for even rheumatoid arthritis. Pretty much any autoimmune condition it will mimic.
I had personally
Lupus and MS are the most common.
What was that last one?
But lupus and MS are the most common.
Yeah. So I had ulcerative colitis and Crohn's disease.
Right.
And I didn't know any of this at the time. And of course, they want to take your colon out and do all this stuff.
Right.
And I went on the raw food diet. And people don't understand, raw food diet, like eating salad, is the worst thing somebody with colitis can do. But if you have a blended salad or juice thing, then it's the best thing you can do. But
Absolutely.
anyway, I was thankfully with good people that knew this stuff, and I got better by eating raw foods and stuff, and feel pretty amazing. But you're saying, though, if I would have went to you, like if we fast forward or fast back many years ago, somebody like me comes to you, I have colitis or Crohn's disease, one of the things you're going to say is, well, that's an autoimmune disease. We're going to get you better, but one of the things we need to do is run a test for Lyme just to confirm that it's not that.
I have been doing that more and more often, quite a bit. And I am seeing a somewhat good pattern happening where I am seeing more patients. For example, I have a lupus patient right now, and sure enough, and she just showed up. She just came to us, and I think it was because of your show. She came, and sure enough, she'd been tested for Lyme. So doctors are beginning to realize that. Unfortunately, saying you've been tested for Lyme doesn't mean you were tested for Lyme, because usually it's the wrong test. But at least more and more doctors are beginning to go, there might be something else here.
Okay, when somebody gets tested, does it say on the test the result if it's positive? Does it say how long they've had it for, or
No.
like is there levels like cancer, like you have stage
Okay.
4 or stage 3?
Okay. Unfortunately, with Western blot serum, you don't know that, because we don't know what stage they're in. The fact that it even shows up is a good sign that at least we can tell, but you don't know. The CD57 does give a good indication if the doctor understands how to read it. Like I said, you're supposed to be at 200. When you start getting around 100, 120, it's like, there's a possibility this person's got Lyme. They're below 60 and below, they have probably had it for 10 years or more. Gets down to about 40, we're looking easily 15 years. And when we get down to the 20s, okay, they probably had it for 20 years or 25 years. That's the point where we start seeing the lesions on the brain. When it's down around 24, 25, we see the lesions on the brain. At that point, we start seeing cognitive issues with the patients, exactly what you would expect with very long-term MS or other kinds of diseases like that.
Can somebody test positive, and I know you say about 10 years, but how long can they go with no symptoms? Can they go their whole life without any symptoms, or eventually will they get to symptoms?
Okay, if they have a good immune system, but not quite good enough to destroy the bacteria en masse, they can go 10, 15 years without seeing any symptoms. Now, I've had patients that started showing symptoms around 5 years, between 5 and 10 years. Unfortunately, because they weren't, like, they would go into the most common symptom is joint pain. The most common and fatigue and joint pain. And so they will show up, and the doctor, almost without fail. Okay, and this, I said lupus and MS are the two most common, but another of the most common diagnoses, which is a horrible diagnosis because it really doesn't mean anything, is fibromyalgia. They'll be told they have fibromyalgia, which simply means you have idiopathic pain. We have no idea why. Okay, but unfortunately, so they go in at 5 years, between 5 and 10 years, and they've got this joint muscle pain. Okay, and they'll do the 16 points of, okay, well, you seem to match that. You've got fibromyalgia, when they
Which
really
is
have.
just like chronic fatigue syndrome, pretty much same thing, right?
Exactly,
Yeah, yeah.
exactly. Yeah, and now here's another problem. Okay, good for you for saying that. Remember, you don't usually die directly from Lyme disease. You die from co-infections, and one of the most common, I'm going to say, I've seen it 70, 80% of the time of Lyme patients. One of the most common co-infections is Epstein-Barr virus. So, which is massive chronic fatigue. So you go in at 5 or 10 years, and you've got this joint and muscle pain. You've got this massive fatigue because the doctor's not been trained in Lyme. They'll go, okay, well, it looks like fibromyalgia. They might actually run the test for Epstein-Barr, and they'll go, oh, you have Epstein-Barr, which you do, but that's not why you have Epstein-Barr.
Sure. 2 questions, and I want to get into exactly the treatment of this, of what you do.
Sure.
So the first question, so years ago, my baby was in a hotel room. We went away to Midwest, got bit by a tick. I found it on her forehead, took it out, mailed it in to find out what was going on. I tried, just after seeing under the skin, I tried to rush them to the nearest pharmacy to get antibiotics or something, but let's say I call you up, hey, I got a tick bite. I was in the woods, I got a tick bite. What immediately, like the tick's still in me, what do you recommend somebody do?
Okay, well, I recommend this to all patients. Okay, now not everyone will do this for acute, most don't. The blessing is most of the acute patients I've had were children. All right, and so children are by far the easiest to treat because they've not had it very long at all. A 12-year-old girl came into the clinic one time. She'd been bitten about 3 months ago, and she'd had the fever, and she was noticing a few little things. Mom was very proactive, got her in. And we immediately started treating her with holistic anti-infectives. Made sure she had a lot. We first of all got her into a vegan diet so that it was low inflammatory, low mucus producing, more raw, that type of thing. So we did that to help her lots of juicing, and had her do a lot of garlic, because now it's the early stages, it's going to work better. But one of the most effective, I'm going to go ahead and tell you a little secret here on treating Lyme. But I also want to make a note here that one other doctor I know of, and he was correct. He made the statement, this is some years back, he said, Lyme is harder to treat than cancer. And so if you have, okay, so I'm putting out this caveat, if you have chronic Lyme, treating it by yourself is going to be very, 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 very difficult. Okay, so having said that, one of the best holistic medicines for treating Lyme is one that we found out by accident. We were in the clinic, we had a big shipment show up, and our vendor that shipped us the holistic meds shipped us the wrong one. And the staff would always bring me in and look over and go, okay, ship it back, okay, and get the correct. Something told me when I went and looked at this one, don't ship it back, look into this. It's not an herb I had used very often. And it was cat's claw. Cat's claw is by far the most outstanding anti-infective I've ever used specific to Lyme disease. You can literally go online and type Lyme disease and cat's claw. So much information on it. It is extremely effective in killing the bacteria, but there's a problem there. Okay, it's a good thing, but a curse too, blessing and a curse. When Lyme dies, and when the Lyme bacteria dies, it secretes something. It's kind of like giving the middle finger to the world as it's leaving. And it secretes something called a cytotoxin. Okay, that gets into the joints, causes a lot of pain. So we have something called a Herxheimer response. Short is Herx response. Lyme patients are very familiar with this. When you kill the Lyme bacteria, you kill too much at one time. It will secrete a whole lot of these cytotoxins, and it causes very significant quality of life style damage or pain to the joints, and it can literally put you in bed for days or weeks at a time. So if you treat yourself for Lyme and you don't know what you're doing and you cause this Herx response, most people will back off and quit, going, that hurt way too much. I mean, we're talking serious, serious joint pain. It means they went too fast, too hard. Okay, and we believe in doing it very, very slowly over a period of weeks and months.
Well, in that situation, I mean, does it just last for a certain time and then you're better, completely better because the bacteria is dead, or is it like, can it kill you?
The joint pain, no, it's not going to
No,
kill
no,
you.
not the joint. Yeah, I mean, this toxin that comes out when you kill all the bacteria,
No, it'll just make you extremely hurt, nauseous.
but not forever. Just for a certain amount of time.
No, but if you do it too fast, you're not going to, believe me, you're not going to want to go through it and you'll quit. And so we recommend for people, first of all, you should have a doctor, that's trained in Lyme. But second of all, when we treat we're talking chronic Lyme, acute, you can treat them pretty fast and hard because it's not gotten severe enough yet. But in chronic Lyme, when we start treating our patients, we literally do not actively, and we're one of the only ones that does this. We do not actively go after the Lyme bacteria until about 2 or 3 months into treatment. We don't. We work on healing the collateral damage, the heart damage, the joint damage, the nerve damage. We work on those while increasing your immune system so you start fighting back. And after a couple of months, the patients are feeling great. Their joint pain's much better, their fatigue's better, their hearts are better, because we do EKGs, we run all these tests to confirm it. We run a CD57, we see the Western blot, oh, markers are starting to show up. Then we start treating the bacteria because you're now ready. But we kind of go the opposite. We do a titrate up. We do very, very slowly. We give you a very low dose, and we tell them you are to contact us every week. It's no charge for contacting us every week. We see our patients once a month when they're on chronic, but we tell them once we start finding the bacteria itself with, for example, cat's claw, we put them on a very low dose, and we say in 1 week, contact me by email, tell me what you felt. And they'll almost invariably, they'll go, ow, I felt a little bit, But after about a week, it leveled out, and I'll go, okay, let's turn it up a little bit. And it may take a week, 2 weeks, or more, depending on the patient and their tolerance. But they basically tear this thing up very slowly as they get used to it and the pain disappears until finally we have them on a very high dose. They have no pain. We do that for a few weeks, and then we go ahead and test them again. But to be honest, depending on the patient's compliance with diet, lifestyle, and medications, it can take 6 months to a year, depending on how chronic it is.
Okay, that was going to be one of my questions. How long? So 6 months to a year is a possibility. Okay, so
But acute, I'm sorry, acute
yeah.
can literally be 3 months and we're done.
Now on acute, when I brought my daughter to get antibiotics immediately, because I thought at that time that's the way it was known. That's what you
Of
got to do
course.
immediately when it's acute. So thankfully, it didn't work out, and I didn't give her any antibiotics because we got it tested and it wasn't Lyme. But what do you say about the thinking that some doctors will prescribe these heavy antibiotics for
Right.
acute Lymes? Do you think that's not the way to go for acute
Me personally, not, but let me point out something you just said. Your daughter we're talking about, right?
at the time? Yes.
Yeah, she got bit.
Yes.
Okay. How quickly after she got bit did they actually run the Lyme test?
They didn't run the Lyme test. I took the tick out and mailed the tick in.
Okay, but you said that she came back negative.
The tick came back negative.
Oh, okay, great. Because
Yeah.
a little FYI for patients, I've had a lot of patients do this. Oh, I got bit, and they go and they run to get tested for Lyme. Okay, the Lyme test will not be even remotely positive until at least 3 weeks after they've been bitten, and it's
Good point.
still unlikely.
Good
So you
point.
have to wait at least 3 weeks
Yeah.
after. Okay,
I
but
had just seen the movie Under the Skin, and I just did the interview, and I was like,
great.
wow, I was freaking out, and I mailed the tick into a place, and they said no, and I was so relieved.
Okay, good. Yeah, because they can check the gut.
Yeah.
Exactly.
So,
Okay,
but that's one thing you would recommend is people take the tick out if they can and mail it in, or
that is done. That is
okay.
done.
But
Now,
no antibiotics.
okay,
For
I have
your
had I have had patients who have literally, by the time they got to me, they had spent, now again, this is chronic, we'll get back to acute, have spent literally $70,000 being treated for Lyme, and it didn't work because they used this cocktail. Now, I am not a fan of antibiotics. I've treated too many patients because of the damage from them. And remember that antibiotics actually suppress your immune system. They don't support it. And here you're working with an immunosuppressant disease. I have seen, even though I don't like it, I have seen success. Supposedly, I'm going to caveat that, supposedly hitting with an extreme cocktail of antibiotics in the extreme early stages. Unfortunately, most doctors, again, not being Lyme literate, will do it for about 3-4 weeks and then stop. The only time I've seen even antibiotics remotely work in acute, it has to go on for about 3 months. All right. Of course, you've vastly damaged the immune system by then, but there's another problem. It may work. Sometimes it does work, it seems. But the other problem is, and I'll say this from a doctor's point of view, the Lyme is the most advanced evolved bacteria I've ever experienced in my life that I've worked with. When it detects it's being attacked, which is very, very often the case, it will do one of or both two things. When the bacteria detects it's being attacked by antibiotics, very often it will literally change the protein structure around the bacteria and make it more impervious to the antibiotic. And if that doesn't work, it will go into what's called the cyst, the CYST. It will go into the cyst stage, and it will literally go hide in the spine. It will go hide in the tissue somewhere, and it'll literally go dormant, waiting for this big storm to go by. And it could go dormant for years. And then one day it'll pop its little bacterial head out again and go, perfect environment. And it'll start back up again.
I have so many questions before we even get into how you treat people, but the next question is a really important one because these are questions about how you get it. So in the movie Under the Skin, and it's been 10 years ago since I interviewed the author, so I have to get an update with him. But he was suggesting that there may be a link between Lyme being sexually transmitted.
Totally. Absolutely.
What's the latest research on that? Because that was 10 years ago when I heard that.
Looking way more positive that it is because again, it's very the Lyme bacteria, of course, is very similar to a syphilis bacteria. It's that same kind of little pig's tail. Um, we are almost 100% certain that it is because, at least in my clinical experience, when it's a couple, so very often that when one has it, the other one will come in and get tested, and they have it also. Now, you can go with the argument, well, they have same lifestyle, so they both go camping, they do things like this, but that's not always the case. Sometimes the other one doesn't go with it, or the person got it umpteenth years ago, and as a couple, they don't go camping, they don't go hiking, they don't do the things that would expose themselves more likely to the deer tick. But I have seen a large number of clinical cases myself as well as others where both spouses have it.
So if
And so
somebody has it, their spouse should definitely get tested as well.
absolutely, absolutely.
Interesting. Now, is it possible? Just thought popped in my head. Can this bacteria somehow, some way, other than a tick bite, be, let's say, injected in someone?
Um,
Is that a
Well,
possibility?
well, I feel very confident that it can happen from sexual transmission, from a bite of a tick. Of course, it's always possible. I've never run across a case where that would seem to be the method of exposure, but because the Lyme bacteria is extremely active in the blood, I suppose it's highly possible. But Lyme unfortunately doesn't get tested, at blood banks.
Because
So
the reason I ask this is I don't want to use the word. It starts with the letter V. I don't want to use the word. Okay. They often, the idea behind the letter V is injecting the actual, I don't know, the situation into the person to treat with, let's assume, good intentions to treat the situation. Is something like this, I don't want to use the words, but is
I,
there or can there be a V Lyme disease thing?
I kind of doubt it. That's I can see it through transfusions. I can see that as a possibility, but not V. No, or just
Okay.
not my experience. I don't believe so. If
Okay.
you,
Okay.
yeah,
I don't want to. Okay. So now somebody's been dying. You confirm they have this, and they've had it for a long time. So you fix their lifestyle up. You tell them they gotta eat better, they gotta live better. You and I, like we spoke last time, you get rid of all. Hopefully, people listen. They get rid of all those bad lifestyles, things they're
right.
doing. Now they're in a situation. Now they're ready to start working with you. The cat's claw. I mean, I don't want you to just give your whole protocol right here, but obviously, anyone in this situation, contact doc immediately. But so what do you do? Well, what do you tell them? Do they need to come to you? Can they work over the phone? What happens?
Well, I mean, I do an extensive amount of telehealth, so I mean, it can all be done over telehealth. All right, I don't want this to sound like I'm doing advertisement for my practice and, oh, you need to come to me. I will caveat by saying Lyme is very, very difficult to treat, and the longer you've had it, the harder it is to treat. Do I recommend that you be with a Lyme litter doctor? It doesn't have to be me. Yes, I absolutely do because it is so hard to treat. Yes, can you get my book, A Holistic Approach to Healing Lyme Disease? It actually has my protocol in there. I have actually had patients follow that, just the book alone, and have had some significant success. Okay. One of the biggest complaints that most doctors have, and it's really with any condition, any condition, any disease, is compliance. Is a patient willing to follow a program? I have found overall it is very difficult for a patient, and they're out there, they're rare, but they're out there. It is rare for a patient to have the willpower and the discipline to follow a program without some kind of support, from a doctor. And I'm not saying that that's all right, but unfortunately, most patients won't do it.
So something as serious as Lyme, you would, even though it's possible, you wouldn't recommend people trying to deal with this on their own. You'd recommend them go to.
The, the longer they've had it, And the more collateral damage that's occurring, like say it's beginning to attack the heart muscle, that's, if you're dealing with joint pain and fatigue, and you think you caught early enough and you want to try it, that's your call. But when this thing has advanced enough to where it's attacking the brain, it's attacking the heart, it's it's probably not a good idea to do it on your own.
Sure, sure. Wow, wow. Amazing, amazing information. Just amazing. I am going to definitely put your contact information, the link to your website below here. And I want to remind everybody, depending when you're seeing this, put your comments or questions below, especially if you can't make it. But next Tuesday, July 18th, we're in 2023. We're going to be doing a live Q&A at 8 p.m. Eastern time with Doc here.
Look
Going over any questions, not just about Lyme, about any questions somebody might have. But if you can't make it, please type your question below. And if you're seeing this after that date, put your questions below anyway, because we'll be doing a lot more in the future together.
And
Yeah.
if I could say one more thing,
Well, I was going to ask you to say as much as you want more to say.
oh,
Say not just one more
appreciate
thing. What else would you like to tell people about
Okay. Well, it's so
anything?
apropos because this is your show. All right. I have to say it has been, I love all my patients, but I have so much enjoyed the patients that have come to me because of your show. I love when patients come to me and they're so proactive and they've already made lifestyle changes. Unfortunately, with America, sad, the standard American diet, 99 easily percent of the patients that come to me are still on the sad diet. They're not vegan. In fact, they're about as far from vegan as you can get. They're extreme inflammatory diets and such. The patients that have been coming to me from you have been such a joy because they come to you obviously because this is the subject of interest to them, raw diet and such. And so I can make this statement more easily on your show than I can in certain other circumstances. And I'm not recommending anything because by California law, I can't give medical advice unless you're legally a patient of mine. And I mean, I treat patients all around the world, so you don't have to be in California. But I can tell you as a general concept, raw juicing is absolutely, absolutely incredible. I highly recommend again the not the sequel, but the first documentary of Fat, Sick, and Nearly Dead. Under Your Skin, I recommend these things, but Fat, Sick, and Nearly Dead, it focuses so much on raw juicing. Raw juicing, I have seen miracles with raw juicing, even when they didn't go to a doctor. But they said, I've had enough of the medical community. I get it, I absolutely get it. And they just went and raw juiced. I'm not saying it's always the same thing not to have some kind of monitoring, but raw juicing, I can say it can be a lifesaver. Absolutely.
100%. I was going to bring that up because when we talk about these changes, preparing your body to get better for the treatment, these are the things that are essential. And I recommend everyone, look, if everyone would just eliminate their cup of coffee and replace it with a green juice every day, I mean, the rates of disease in this world would go down tremendously.
Absolutely.
You
I
know,
know that sounds simplistic, but it's true.
I just did a video about juicing, and a lot of reason people don't juice is because they say they make up excuses, but uh, it's just amazing. There's a new juicer out called the Nama J2 juicer
We
that
got it.
is absolutely amazing. That I highly recommend people get this. It's I'll put a link below in the video. It's absolutely. I just made a juice. I mean, I'm working in my yard. I'm getting ready for this interview. I'm doing things. You can just put the stuff in the juicer and walk away, and it does it for you.
Correct.
It's amazing.
Well, obviously, my wife and I have juiced for decades, and we've used Jack LaLanne, which is great. We used the Breville because we saw it on Fat, Sick, and Nearly Dead. We originally used the Champion juicer, when it was in its heyday. But we recently, and I'd say within the past 6 months, we switched to the Nama juicer. This is going to sound like a commercial, but super easy to clean. That's such a big deal when it comes to juicers. Super easy to clean. You literally, like you said, you can walk away. The pulp is dry, at least the ones we use. So we're a big fan of it. We bought it long before we spoke to you about it. Highly for ourselves, we highly recommend it.
Listen, whatever juicer you people try to use, I'm telling you this. Step number one, and I think you would agree with me, any disease, any illness, even if you don't have a disease, step number one, the first thing you should do, people contact me, how could I change my lifestyle and my diet so I don't get sick? Step number one, add green or vegetable juices to your diet. That's it. Add juicing. If you could juice, I mean, the more the better, but if you could do one green juice every single day, your life will change. It's
I
amazing.
agree with you. Well, one of the best, and I think I mentioned this before, but I'll say it one more time real quick. My favorite scene in Fat, Sick, and Nearly Dead is, he's got this huge platter. It's like a turkey platter in front of him, but it had this huge mound of salad on it, all colors. And he said, I can't eat this 3 times a day. It's too much material, but I can juice it 3 times a day. And I'll have patients ask me, because a lot of our cancer patients are now doing the juice, 100% juicing, no solid food. What a lot of people don't understand about juicing is whenever you eat anything, okay, solid food, even if it's healthy vegan raw food, you still have to use some of your store of enzymes to break it down and digest it. All right. Those enzymes could have been used for something else. Now, raw food has a lot of its own enzymes, so that helps, but most people aren't raw. When you juice, you are flooding your body with micronutrients that you didn't have to break down anywhere near as much. So all that energy and enzymes that goes into digesting food can go towards healing. And now you're being flooded with the micronutrients that are the building blocks for healing. So I love seeing them do it as much as I can, but absolutely correct. At least once a day. And one of the biggest things I hear from patients, and this is a big thing in America, who start juicing. I had one email me 2 days ago, and she said because she's doing 100% juicing right now, she has cancer. She said, my energy is through the roof. She said, so much, and again, just juicing once a day, you will probably be surprised. Now, a caveat, because you're going to hear this, people that juice extensively for the first time, they're going to go, oh, I started juicing and I felt so sick. They'll go, the juicing made me sick. It's not the juicing making you sick, it's the detox, and it's okay, it will pass.
Yeah. So, did you say you put your cancer patients on juice fast?
Absolutely.
For how
Absolutely.
long? How long?
Well, there's those that are scared, and I understand it. All right. And then there's those that are like gung ho. The gung ho, they literally go into 60-day juice cleanses, and their markers are absolutely outstanding what we see. And then there's those that are a little fearful, so we say, let's try 3 days. Oh, you made it. Let's go to 7 days. And then before we know it, we're at a month, and we have a full menu plan and everything that we give to them so that with recipes so that they know what they're doing. I have never, ever seen a patient be damaged from a juice fast when it's done correctly.
Wow. Well, we're going to do a whole nother episode on cancer and juicing because that's a powerful subject. And
Yes,
just
it is.
juicing in general, everybody, any juicer you're going to use is the right juicer for you. But what makes it so easy is going to keep you doing it. So that's why we recommend the Nama
Right.
J2 juicer. And I'm going to put the link below. And also, I'm going to give you a coupon code where you can get 10% off the juicer. So put that coupon code. The link will be below as well. And then finally, I can tell you that I love the juices so much I become an affiliate for them, and it's a win-win for everyone. They actually give me a little commission for that. That helps me continue to make videos and do what I do on every single level. I recommend the Nama juicer, the Nama J2 juicer. It is absolutely amazing. And I told the company before any of this, I said, look, even if you don't give me that affiliate code or commission, I'm still going to promote it because I want people to be healthy. And it's absolutely amazing. They were very thankful for that, but I'm thankful for them because the company itself, I don't know if you know about the company, but their philosophy is just helping people to help themselves and to be healthier. That's why they wanted to make a juicer that was so easy to use.
Well, you're right what you just said. But I know before you get ready to go, one of the things that deters people from juicing. There's several, but one of them is the difficulty of the juicer. For example, I love the Breville, but it's not the easiest one to clean. And people get burned out on that really fast. My wife was not happy after, weeks of, cleaning the Breville. Great juicer, but it's harder to clean. You have a juicer like the Nama, it's just super easy to clean, super easy to work with. You're going to have higher incentive to keep doing it. So yeah, I agree.
Absolutely. And I tell everyone, besides the whole coffee thing, I tell people if you have a microwave oven, replace it with a juicer and then use the juicer because most people have juices, they just don't use it. You know, it's
I
like,
love it. I love
you
it.
know, so you got to use it. So, but this has been an amazing interview, and we're going to be doing our live Q&A coming up on Tuesday night, the 18th of July.
Look
We're in
forward to it.
2023. And again, if you missed that or whenever, put your comments or questions below, and we'll be doing another episode about the cancer and juicing, or we'll be doing other episodes about a lot of things. Doc, you're amazing, and I'm so glad to know you, and thank you for the work you're doing, because I know all the charity work you do and the traveling you do and the hard time you do to get out and do all this, but you're a blessing, brother. Thank you.
I return the compliment. You have been such a influence in the industry, and there are many raw juice and raw food channels out there, but you've always been my favorite. You're very blunt and full of information, and not just trying to shill something constantly. So I appreciate what you're doing for the world as well. Thank you.
Sure. Everybody, Doc's information, his link, his contact information, his website, all that's going to be below the video in the description. So please contact him, check it out. And even if you're not sick, even if you haven't been diagnosed with anything, even if you don't have symptoms, if you just want to prevent and feel better, I definitely recommending having good people in your life to guide you and coach you. And there's a lot of life coaches out there or doctors out there. I recommend everyone contact Doc here, and just even if you're doing it just an initial, hey, I'm feeling great, but I want to make sure I stay great. Can you look over what I'm doing, and do you recommend anything, and so on? And it's definitely important. So to get in touch with you, and thank you everybody for watching. Again, those codes for the juices are below, and Doc's information below. We'll be back Tuesday night. Thank you so much, Doc, for your time, and anybody with MS, with lupus, with any autoimmune disease, with arthritis, or just especially Lyme's. That's why I want to do this video, is Lyme's. I have a good amount of videos from years ago of Lyme's on my website, because I find it amazing that no matter how well you eat, no matter how big and strong you are, you know, one little tiny tick can destroy your life
I've
if you're
seen
not
very
treating
big,
it
bulky
correctly.
men get taken down.
Yeah. So this is absolutely important information, and as good as eating healthy is, there's no panacea out there. So it's good to know this information. So thank you, Doc. Thank you, everybody, for listening. Have a blessed
Appreciate it.
day, and keep rocking out there. Thank you.
Thank you.
All right, Doctor. Thank you so much.
Nature's wealth, good for your health. This is the Raw Life Health Show. Nature's wealth, good for your health. This is the Raw Life Health Show. Nature's wealth, good for your health. This is the Raw Life.